this is part 2 of what is Graves' disease. So we went into the first part of the video what this disease is, how it comes about, how the immune system is the real problem and not the thyroid itself. And we went into what physical signs and symptoms that you see that makes you even suspect that you might have this for you to go get checked out. So let's say you've been checked out, you've been confirmed to now have Graves' disease. What can you do about it? Okay, so I'll talk about first the conventional treatment, and then we'll go into some things that we can do holistically to help it. So conventional treatment, think about it, right? The focus is we've got to kill the thyroid and we've got to suppress the immune system. That's the summary of the conventional treatment. So as I go into the different drugs and stuff that we use, keep that in the back of your mind that that is the goal. Kill the thyroid, suppress the immune system, okay? Holistic approach, on the other hand, is saying, hey, the thyroid itself is fine, right? It didn't do anything wrong. It was listening to the signal that it was getting, and it was producing the hormones as it was getting the signal. So the thyroid itself is functioning normal. So let's not kill the thyroid. Instead, let's fix whatever is triggering the immune system to start attacking the thyroid. Does that make sense? So we know that in patients that have autoimmune disease, it is usually a trigger of the immune system for some specific reason. We have a list of things that we go through, a checklist, to say, does this patient have those triggers? Because if they have those triggers, let's go remove those triggers, because then it's going to cause the immune system to slow down and stop doing what it's doing, right? So instead of just killing the thyroid and suppressing the immune system, rather we want to remove the triggers, the risk factors, and help the immune system heal so that it can stop attacking the thyroid. That's the holistic way of treating Graves' disease. All right, so now let's go into it. What are the drugs that you commonly get given or prescribed when you are diagnosed with Graves'? The first one you might hear about is metamizole or PTU, okay? So those two drugs are the most commonly used to help block the thyroid from making T4 and T3, right? From making thyroid hormones. So PTU is a propyltiouracil. It's basically a drug that is designed to just block the thyroid gland, right? So that it's not able to make any hormones. Then metamizole is also most commonly used. The reason why, it does the same thing as PTU, but its side effect is a little bit less. So most patients find themselves on the prescription for metamizole. And it works well. I'm not saying that it doesn't work. In fact, when you start patients on it, you check their labs within 6 weeks, you can see the thyroid level drop drastically. So that is one way to treat it, and it does work, and the patients feel better from that treatment. The other option, or the other treatment that's commonly used, is what we call radioiodine, right? We basically irradiate the thyroid gland with this radioactive substance called I-131, okay? So this radioiodine is basically going to be a radiation treatment that kills the thyroid cells that are overactive, meaning whichever cell is busy making a lot of T4 and T3, poof, gets killed with this radioactive iodine. And sometimes radioiodine works too well, where it kills too many thyroid cells, and now the patient goes from having hyperthyroidism, where they can't gain any weight, to hypothyroidism, where they become overweight, okay? So when it works too well, now we have to put the patient on a thyroid prescription to help bring their thyroid hormone back up, okay? So we give one drug, works too well, then we give another drug to treat the side effect. You guys see where I'm going with this? Okay, so radioiodine is not, the best, but for some patients, it's the treatment of choice, okay? So other treatment that we do conventionally is surgery. A lot of times when we see patients with this condition, they've developed huge amount of nodules, huge amount of goiter to the point where it started to cause obstruction in their swallowing, in their speaking. Some of the biopsy comes back showing atypical cells that's now kind of like precancerous looking. And that gets very scary because we never know when that's going to progress to thyroid cancer. So when that happens, surgery is the option. Now, surgery might be partial, where we just take the nodules out, or it could be partial, where we take one part of the thyroid gland out, or it could be total, where we take the whole thyroid gland out, right? Once the whole thyroid gland is taken out, now we're dealing with, definitely you're going to be on thyroid medications for the rest of your life, because there's no other way to survive with no thyroid, okay? I told you all the different things that thyroid does, over 200 things, right? So we don't want to live with no thyroid hormone. So at that point, if surgery is a total thyroidectomy, we've got to put you on some thyroid replacement, okay? So another treatment that is done conventionally is not to address the thyroid, but just address the symptoms, right? So if your patient is having palpitations, we put them on a beta blocker to slow the heart rate down, right? If your patient can't lose weight, we put them on some weight loss drug, and so on and so forth, right? If the patient's having constipation, we'll put them on something to help with that. And we just kind of pick the symptoms and we treat it. Pick the symptom and treat it, right? So that is one approach. Not my favorite, because it's a bunch of band-aids, right? I'm not really addressing the underlying issue. The immune system is still there attacking. The thyroid is still there responding. I mean, we gotta like look at that and weigh it. For each patient, we gotta see risk-benefit ratio balance. So let's say we decide, okay, conventional treatment is what I want to do. Fine, we use one of those methods, we do it, but we follow you every few months. We're checking your levels, making sure. Sometimes we go back and tweak the dose of your methimazole. Sometimes we go back and tweak the dose of your beta blocker, and so on and so forth, right? So, or if you've been put on thyroid hormone because we over-treated with the medication, now we gotta be monitoring the level of that thyroid hormone. Okay, and all this time we're also making sure that those antibody levels are not coming back, right? So we're checking those antibody levels again, also monitoring them routinely. Lastly, let's talk about the holistic treatment. So what is the holistic treatment? So kind of like we talked about the holistic treatment of the Hashimoto's disease, where the thyroid is not functioning well, we also have the conventional treatment of Graves'. So I'm going to talk about that on the next video. Make sure you don't miss it. Subscribe to the channel, click on that button so you don't miss any video that I release. All right, I'll see you on the next one.